We answer viewer questions every weekday on COVID-19. There are lots to get through, and here to help us is 9 health expert Dr. Payal Kohli. Dr. Kohli, good morning. Our first viewer asks, if I have a cold but no fever, just a sore throat and congestion, do I need to get a test? That person does say they work at a grocery store.
Good morning, Gary. So one thing we've realized with this virus is that it can really throw us a lot of curveballs. And in fact, early in the course of the virus, we got a study out of China that was published in the New England Journal of Medicine that said 5% of people can have sore throat and about 15% of people can have nasal congestion. And a lot of these people were having these mild symptoms early and then going on to have fever and some of the more systemic symptoms later. So the short answer is yes, absolutely yes. This virus can really present all the way from no symptoms at all to very severe symptoms, including fever, cough, and shortness of breath. So these symptoms do warrant a test. And at the very least, I would say you absolutely need to stay home from work because you don't want to be potentially exposing others.
Yeah, especially at a grocery store. All right, another viewer asks, if the stay-at-home order doesn't get extended, should I still visit my mother in a nursing home after April 26th?
You know, now this is a very important question because what we do after April 26 is in some ways going to be even more important than what we're doing right now. Because right now, our mitigation efforts are really helping with social distancing, controlling the spread of the virus. But if April 26 comes and the stay-at-home order doesn't get extended and we all go back to life as usual, we're going to get a much larger second spike of the virus because it's still around. So the answer to the question is yes, unfortunately, you need to stay away from nursing homes. We've seen over and over again that nursing homes become a hotspot for infections and they spread very quickly, and people who get these infections in nursing homes do very poorly. So to protect your mom and to protect the other people in the nursing home, it's really important to limit the number of visitors that are coming in and potentially bringing in the virus, regardless of whether the stay-at-home order is lifted or not.
Yeah, that's so tough, but so true. All right, our final viewer asks, for this morning anyway, asks if there's a disparity between ethnic groups in COVID-19. In other words, does one group react differently to the virus than another group?
So we do see that there's a disparity in the outcomes of African Americans as well as Latino Americans or those of Hispanic origin, and in the sense that those groups tend to actually do worse and have a higher risk of dying from the virus. But it's not so much the reaction of the body to the virus that's causing those differences in the outcomes, but rather the underlying risk factor profile. So unfortunately in this country, we also know that African Americans and Hispanic Americans tend to have a higher incidence of hypertension, diabetes, asthma, and many of the other things that correlate with poor outcomes with this condition. And they also tend to have worse control of these conditions. So it's sort of a double whammy because they have a higher incidence of the risk factors that make you do worse, and they have worse control of these risk factors. So if they come down with the virus, it actually leads to a much more catastrophic outcome for them. So I have now started considering my patients that are African American and Hispanic American to be in those high risk groups, and they need to be extra careful with their preventive measures to really decrease their chances of getting this virus.
As always, very informative, Dr. Kohli. Thank you.